Good morning, everybody, and congratulations to France. I think our session is less full because people are probably still celebrating, and with the reason. It was a great pleasure to be in Toulouse last night, seeing first of all, the nervousness during the game, and then the happiness of the win. So congratulations to France and to the French team. Although Uruguay lost against them, it's always a problem, but definitely a great team, a great game. My name is Lydia Brito. I will be moderating this session. It's a great honor to be here with both of you. In an interesting topic, why Europe must lead drug policy reform and the decriminalization of drugs. For that, and it's an interesting topic not only for Europe, but definitely we are in Europe, we are in use of, so we will be focusing mostly in the situation of Europe. And I have two great speakers to address these topics. The first one is Professor Michel Kazatchkine. Michel is a member of the Global Commission on Drug Policy. He's a former executive director of the Global Fund to fight AIDS, malaria, and tuberculosis. And the second speaker, we have Sir Nick Clegg, member also of the Global Commission on Drug Policy, former Deputy Prime Minister of the UK. We couldn't have better speakers to address these topics, and I hope we will have, since we are not that many, a very lively discussion. They will introduce the topic, and then we pass the ball to you, and we want goals. So we want very good questions so that our panelists can indeed go into depth into this subject. The first one, Michel, I will pass the floor to you, and welcome both. A great honor to be with you.
Thank you very much, Lydia. And good morning, everyone. Thank you for being here on the day after that great game and celebrations. One may wonder, why would the topic of drugs, war on drugs, drug policy reform, be a topic for ESOF? Well, I thought I can see at least two reasons. ESOF is a forum about the intersect between science, evidence, policy, and society. And this topic is a timely debate for ESOF. If you think of what happens across the world, the debate on drugs is everywhere. It is in the US with, at this time, one person dying from overdose every 7 minutes in the United States. It is in the Philippines with every day tens of people killed in extrajudicial killings driven by the state. It is in Eastern Europe where the HIV/AIDS epidemic is still growing and primarily driven by unsafe drug injection. And it is in Europe and in many countries in the world, if you think of the debate on medical cannabis, on decriminalization and legal regulation of cannabis and other drugs. So the debate is timely for ESOF. And then, to me, it's also a very relevant debate for ESOF, because as a physician and a scientist, or a former scientist, I must say I cannot think of any other area of medicine and social sciences where the gap, the distance between what the evidence tells us we should do and the policies we have is so great. Sir Nick and I, as members of the Global Commission on Drug Policy, are here today to really call on closing that gap between evidence and policy. That gap has killed millions of people and generated a huge amount of unnecessary and avoidable suffering of people and communities across the world. So as I just said, and Lydia introduced, as members of the Global Commission on Drug Policy, I thought I would show this slide, which lists the 24 members of this commission. The commission was initiated 6 years ago by 4 former Latin American heads of states, and primarily under the leadership of Fernando Henrique Cardoso, the former president of Brazil. It has 24 members who have, in their own sector, somehow had leadership positions in government, for many of them in the United Nations, in science, in culture, or in the private sector and business sector. And these are, we call ourselves sort of citizens of the world, coming together to advocate for more evidence-based, more health-oriented, more human rights-oriented drug policies. And we're here to also say that the current way of dealing with drugs, with illicit drugs, is just unacceptable and not the way to go. So I'd like to elaborate a bit on this and then to turn to Sir Nick for him to focus a little more on Europe and the current situation in Europe. So I'll speak from a more general perspective. Our starting point is that we should, and we have as a commission, first recognized and acknowledged the failure of the current prohibition, law enforcement, repressive policies on drugs, what people call the war on drugs. This is a quote from Richard Nixon in 1969 on cannabis. And the war on drugs has really been going on, led by the US in Latin America, but it's going on everywhere in the world today, in the Philippines, a few years ago in Thailand, Indonesia. It is a war on drugs, but in fact it is a war on people who use drugs. And as you know, and to make it very simple, those whom we should really wish to see arrested are not the small dealers, not the people who use these drugs, but the big fishes, and these somehow have been escaping the system. This punitive approach to illicit drugs has really been reinforced by the 3 international United Nations conventions that rule the international drug control system. But if you read carefully the texts in 1961 and then in the 70s and then 1988, the text of the convention, the preamble of the convention, say that the international drug control system is there to improve the well-being, welfare of people. It is there to make sure that people who are in need of opiates for managing pain, for palliative care, have access to these medicines. But the result has been at the opposite of the intention. The result has been that the focus has been on preventing diversion, on repressive approaches, and actually people in need, for 75% of the people worldwide, do not have access to these medicines. So we should recognize that these policies have failed by their own measure. These policies were founded somehow on the misguided hope, I would say, that illicit markets would be extinguished by focusing on arresting people, destroying crops, so fighting on supply side on one side, and then with by arresting people and putting them in prison and taking harsh measures, discouraging people, having a deterrent effect on demand. But in fact, what happens is that more and more people consume drugs worldwide. It's hundreds of millions of people every year across the world that would use illicit substances, some for their enjoyment, some to relieve pain, moral, physical, some because of traditions and culture. So the result of these policies is, in fact, that more drugs than ever are being now produced and traded. Last year was a peak, the highest peak ever reached in terms of opium production in Afghanistan and worldwide. There are, as you know, new psychotropic substances coming on the market every day with the synthetic drugs. And there are more dangerous drugs, as we are seeing with fentanyl, which is the major cause for overdose death in Canada now. But not only have we realized, and should we realize, I would say, that these approaches have failed, but we have also realized that these approaches have actually been harmful. And here I'd like to quote a member of our commission, Kofi Annan, who says that drugs may have harmed many people across the world, but poor government policies have harmed many more. And that's very much the basis of our advocacy as a global commission. That failure is also, and that harm is also that prohibition has actually generated a huge black market, a huge parallel economy, which is estimated to be worth $350 billion per year. A huge economy with, of course, corruption and threat to democracy in a number of basically narco-states that we know of across the world. These policies have been harmful with regard to the health of individuals, the health of populations. These repressive policies have fueled an HIV and hepatitis epidemic across the world. Do you know that 1 out of 3 HIV infections occurring outside sub-Saharan Africa these days is actually associated with unsafe drug injection? That 1 in 4 person who injects drugs is HIV positive. 2 out of 3 persons who inject drugs are positive for the hepatitis C virus. And then there are these overdoses that have been occurring everywhere and that could not be prevented because of lack of access to naloxone. All of this linked to the fact that because people fear arrests, they would hide, they would go underground, they would inject in a hurry, and then they would share needles because they would be prevented from getting these needles by, again, wrong policies. Another health harm is also the fact that because drugs are illegal, illicit, you don't actually know what you buy on the streets. You're told this is heroin, but then maybe it's heroin cut with fentanyl. And there's a lot of harm due to adulterated drugs. And as I said earlier, another sort of perverse effect of these repressive therapies has been that people who actually need these medicines for pain management or palliative care do not have access to the medicines because the system is so complex at every scale for physicians to prescribe, for governments to control, that actually most people in the world do not have access to these medicines. And I will not touch here on the opioid epidemic in the US, but we can discuss it later in our panel. These policies have led to human rights abuses, starting with death penalty for minor low-level drug offenses, extrajudicial killings, as we now witness in the Philippines and witnessed in Thailand a few years ago. They have led to an escalation in law enforcement, militarization of the law enforcement. In Mexico, over 160,000 violent deaths have taken place since President Calderon started the war on drugs in Mexico. And of course, every day and across the world, the police may go into extrajudicial policing practices, instilling terror and fear among communities. Those policies have also led to a wave of over-incarceration. 1 out of 5 people in prison these days across the world is incarcerated because of a drug offense. And in Europe, to quote a European figure, out of 1.4 million arrests a year approximately for drug offenses, 82% are just arrests for possession and for personal use. Which brings me to another sort of vicious harms, which is that governments across the world have also used these repressive approaches as a tool of social control. In the UK, where a person is arrested and searched every 58 seconds, you have a 6.5 times increased risk of being arrested and searched if you are a person of color as compared with if you were white. And finally, we also would like to draw your attention to the fact that the criminalization of illicit drugs, whatever drugs, not only cannabis, we're actually talking about all drugs together. When someone is arrested, leads to that person having a criminal record. And not only is it destroying a life of a young person to have that person in jail for 2, 5, 10, 15 years. In the US, you have minimum jail sentences that are compulsory. But a criminal record is something that can ruin a young person's life. How can you then go for a loan? A mother can be separated from her children. You may be prevented from a number of jobs. You may be taken your driver's license, and so on. And just to end on these harms, we in the Global Commission strongly believe that criminalizing use and possession is really interfering with a basic human right, the right to privacy. If you're doing no harm to others, why would the state interfere? A state can or should only interfere with the private life of someone if it is with a legitimate aim, if it is proportionate, if it is necessary. And we do not think that these criteria are fulfilled when arresting and incarcerating young people for just use and possession. So this is why, and I'll end up with this, as a Global Commission, we have been advocating for what we call 5 pathways to drug policies that work, 5 pathways for reform. And what we're saying is that rather than continuing wasting huge amounts of money on ineffective repressive policies, one should really focus on policies that first give priority to people's health and safety. If your policies do not help and do not support the health of your people, change your policies. This is a message, let's say, to the Russian Federation that still considers methadone, buprenorphine, and what we call substitution therapy as illegal for ideological reasons that have nothing to do with the huge, comprehensive, and just undisputable amount of evidence showing that these approaches can prevent HIV infections among people who use drugs. And as a result, in the Russian Federation last year, of the over 100,000 new cases of HIV, 50% were still among people who inject drugs, whereas this figure is 0 in Western Europe, 0 with harm reduction. Second, reforms that would really ensure access to essential medicines and pain control for people in need. 3, end the criminalization and incarceration of people who use drugs, and that, I think, should be at the center of today's discussion. And then refocus enforcement responses to drug trafficking and organized crimes, and not continue to waste money and energy and police forces on catching users or small dealers on the street, or people who are driven by economic necessity to go into low-level drug trafficking. In my country, France, 150,000 arrests every year for cannabis. And then we complain that we do not have, again, enough police forces to fight terrorism. And finally, in 5, we are advocating for moving from prohibition to regulation, that is, to legal regulation of drugs, so that the markets are no more in the hands of the criminal organizations, but back under control of the government, as it is done for every potentially dangerous substance, be it a medicine, an isotope, a food preservative, a car, whatever. You don't forbid or prohibit something that is potentially dangerous as a society. You regulate it. So I'll end here and turn it to Nick. Thank you.
Thank you very much, Michel and Sir Nick.
Well, thank you. I'll stay seated if that's okay. I think Michel has set out perfectly and comprehensively the purpose of the Global Commission on Drugs and what we aim to do. So let me, before we open it up to wider discussion, let me just provide some reflections from someone who, Michel, you called yourself a former scientist. I'm something much, much worse. I'm a former politician. And my perspective on this, therefore, comes from the world of politics. I was in elected politics for close to 20 years, and does not come with the expertise that we've just seen expressed by Michel. So let me elaborate a bit from that point of view. I mean, the first thing to say is, much though it might, of course, come as a shock to those of you who come to a important conference like this about science, we are capable as societies of doing deeply irrational, self-harming things, despite all the evidence and all the data and all the science pointing to the contrary. And it's important to emphasize that the collision between science and politics, between evidence and emotion, is not new. It's an ancient one. Oddly enough, even though science has progressed, the power of fear and emotion to nonetheless lead societies to collectively do irrational things has not diminished. And when I came into government, I was Deputy Prime Minister of the United Kingdom for 5 years, from 2010 to 2015. I had already developed a view that there were, of the many irrational things that, not just the United Kingdom, but that so-called sophisticated democracies do across the world, there were 3 things that I found particularly striking and alarming in their irrational and self-harming effects. One, the way in which we incarcerate people, particularly on short-term prison sentences. It differs from one criminal justice system to the next. In the United States, of course, it's far worse than anywhere else, but in the UK it's worse than other places in Europe. But the irrationality of putting people who've committed a crime for a few weeks or a few months into prison, where all the evidence is overwhelming that all that does is perpetuate cycles of crime, in other words, leave a greater number of victims in their wake, was one example. The other example I always felt was the disproportionate amount of attention we devote to physical health as opposed to mental health. Because again, all the evidence shows overwhelmingly that mental health is a huge, huge problem, which has always been treated as a sort of Cinderella service in pretty well all health systems across the developed world. And the third area was drugs, for all the reasons that I won't repeat, that Michel has described. We've been using, as a species, we've been using drugs of one description or another since the dawn of time. And we have been applying in most of the developed world a criminal justice approach to something which has, in many respects, quite sort of profound social and cultural roots. And here's the thing, these three things, incarceration, mental health, and drugs, have all come together in developed economies. If you look at the most persistent social problems in pretty well every developed economy on the planet, you will find this nexus of mental health not being treated with the same attention as physical health, excessive levels of incarceration, particularly on short-term prison sentences, and drug users being treated or being trapped in a criminal justice system rather than being treated in a health system. So these were the assumptions, if you like, that I carried with me into government. And then when I went into government in 2010, I found something even more alarming, which is that when I spoke privately to my then colleagues in the government that David Cameron and I formed, I couldn't find a single minister, senior minister, who did not agree with me that what we were doing with drugs was deeply irrational. But they then would go on to say, but we can't possibly do anything about it. And the reasons were because there were other more important, pressing problems, there were other crises in politics and in government, just as in life. You only have so many hours in the day, you have to choose what you prioritize, it's just simply not a priority. The newspapers won't like it, the voters are alarmed. And so one of the things I realized was that a lot of this is because of something quite primitive. And it is this, it's the power of fear. It is impossible to exaggerate how fear of criminality, fear of mental health, which has always been something which has been cloaked in taboo and had a lot of sort of fear attached to it in societies down the ages, and fear of drugs, that fear, which is incredibly kind of almost atavistic, primitive fear, leads voters to support policies which the politicians who represent them in turn know will not help the problem, and in fact, in many respects, will make it worse. And so that's, in a sense, the cycle we're trapped in. It's that the evidence is clear that what we're doing is not helping. In fact, as Michel explained, it's in many ways making things worse. And that the climate of fear means there is this feedback loop between voters and politicians which paralyzes creative and innovative policy making. And because of that paralysis, what's happened in the United Kingdom, and it's happened in many parts of Europe now, is that you have this hypocrisy, really, between the stasis of the political debate and actually quite a widespread outburst of ingenuity and innovation and experimentation on ground level. So in the United Kingdom, there are now police forces in the United Kingdom whose leaders have explicitly said, we are not going to ask our police officers to arrest people for carrying drugs or taking drugs for their personal use. We're just not going to do it. So you have the police basically saying, we're not going to apply the law because we think the law is idiotic. How striking is that for a country which has always prided itself on its attachment to the rule of law? If you go to any of the pop festivals that hundreds of thousands, maybe millions of teenagers go to this very time of year, June, July, August, you will now see very progressive experiments in youngsters being able to bring their drugs to a little booth, to have it tested, to check what's in it. You have in Glasgow, the Glasgow City Council is applying now for the United Kingdom's first drug consumption unit room, much as they have pioneered in Switzerland and other places. And you now have senior conservative politicians. William Hague is the latest. He was a foreign secretary in my government, and the Conservative Party has always been, as Conservative parties generally are, the most hostile to policy reform, coming out publicly saying that the war on drugs, the approach of criminal justice, is an irrational one. And I should stress, by the way, that when I was in government, one of the things I got the then Home Secretary, Theresa May, to do, much though she hated doing it, was I obliged her department, the Home Office, to commission a study, very carefully calibrated, conducted study, comparing different jurisdictions around the world and their treatment of people who take drugs. And it found there was a clear empirical assertion which it concluded with, namely that there was no correlation at all between the severity of the criminal justice sanctions applied and the reduction of harm. So what you have at the moment is this really odd, in Europe at least, is this really odd sort of potpourri of political public hypocrisy and private recognition, accumulating evidence that what we're doing is wrong, and a web of health practitioners, police forces, and others basically eking out innovation where it is possible. And then meanwhile, some of the big innovations, policy innovations, are happening outside Europe. So very strikingly, you live in Uruguay, or you're now presently based in Uruguay, Canada from this autumn, many states in the United States are moving to the world's most sophisticated experiments in the full regulated sale of cannabis. Now, there's a whole debate that we're having in the Global Commission. We're publishing a paper on this subject in September at our next plenary meeting in Mexico about what is the best model of regulation. Because there are bad models of regulation which over-commercialize it, over-glamorize it, and other more cautious, small c conservative forms of regulation that do exactly what it says on the tin, which regulate a substance or substances, drugs, which can be taken, and in fact by the vast majority of people are taken voluntarily and safely, but can inflict harm. So the interesting thing is that whilst in Europe we used to be in the lead in all of this, we've now actually curiously been overtaken by policy innovations in the Americas. I think one of the reasons for that is because the experiments in Europe, whether they are open national experiments which have been de jure sanctioned by governments, the decriminalisation in Portugal is always referred to, some of the measures taken in Switzerland are often also cited, or whether it is the sort of much more disorganised de facto form of liberalisation that you see in countries like the United Kingdom in the way that I described. For whatever reason, we thankfully do not have the same levels of outright crisis that you see, for instance, in the United States. So I think maybe we are, curiously, a victim of our own half-success. We've sort of half dealt with this in a not wholly honest way, but for that reason, it's not led to the public outcry or pressure to really then go the full extent of the logic of our reforms and introduce fully regulated markets for drugs. So that's a sort of thumbnail sketch of what brought me into the debate, a little description of some of what I found when I was in government, and the odd, rather ambivalent, rather uncourageous position that Europe now finds itself in a debate where, as I said, in the past, a lot of progressive, innovative, science and evidence-based thinking emanated from Europe, yet at the moment, for reasons as much driven by social and criminal justice crisis elsewhere, is actually being propelled much faster and further in the Americas. I hope that's of some interest.
Thank you very much. Definitely, and I think we are in Ease Off is about science. And maybe before I open the floor to the participants, I wonder, you talked about courage, you talked about not being able to use the evidence, you talk about also hypocrisy, the difficulty to really being honest also with the public and the voters. But what can science and scientists do? How can we communicate better the scientific evidence, not only to the politicians, but also to the public? How can we support these bottom-up actions that you were mentioning? How can we support the countries that moved with the reforms to make sure that the science keep informing those new policies? Can you, both of us, give some ideas on that? Maybe we start with you, Sir Nick, and then.
Well, to be fair, scientists are, not just obviously prominent scientists such as Michel, are speaking out more and more. So, for instance, in the United Kingdom, the British Medical Journal, one of the sort of more venerable scientific medical journals, has, I think, relatively recently come out in favour of the full regulated sale of drugs. There are certain royal colleges, I think it's of physicians, who've also recently come out in favour of extensive policy reform. The problem is that for a lot of scientists, not least those who depend upon grants to conduct their research and so on, it isn't a very fashionable area of research. And in some areas, the law itself actually restricts research. So in the United Kingdom, which obviously I know best, there's a very well-known researcher into this, Professor David Nutt at, I think it's UCL. And he explained to me that it's just so difficult for them to do the research on, for instance, cannabis, because cannabis is presently, I hope this will be changed soon, because one of the shifts in the British political debate, by the way, has been now in favour of making cannabis available for medicinal purposes because of a recent attention devoted to 2 young children who had epileptic seizures and who had been deprived of their cannabis-based medicines. But anyway, cannabis at the moment is categorised as a Schedule 1 drug. And that means it's very difficult for researchers and scientists to do good scientific research in a substance which is, under the criminal justice system, categorized as a very, very kind of taboo substance. The WHO, Michel knows about this more than I do, at the moment doing some work on international forms of scheduling of drugs. So I think scientists do try to be brave where they can, but I think it's really difficult for them when they're dealing with such an irrational way in which drugs are categorized, both internationally and nationally.
First, I of course fully agree with what Nick just said. I'd like to add 2 points. One is that there is a social responsibility for scientists, and that is to speak to citizens and not just publish in journals. And it's to engage in debates at local level, and of course at higher level, but not necessarily with government, because we heard about how government can receive and somehow accept the evidence but then not move. But let's say with parliamentarians, for example. I have been living in Switzerland now for about 10 years. And Switzerland is not a very progressive country. It's a conservative country. And it has promoted the most progressive drug policy reforms in Europe somehow. And the way it has done it is through a long process of dialogue between the scientists, the politicians who were actually driving the reforms, and the people. I have seen, you know, a parliamentarian and a scientist coming as a couple to talk to an audience of 10, 20 people in a small village on the reform. This is on cannabis now. But years ago, it was about accepting safe injection rooms. It was about accepting heroin substitution treatment, which is still not accepted in the European Commission space. And that led to those reforms in Switzerland to be approved by 15 successive referenda, where people from all parties somehow would vote in favor of these changes, because they were actually told the truth. And they could have debated. So my first point is for scientists to come out of their labs and speak to people and provide the right information. And that's so fundamental at a time when, if you go to the web, you can find whatever may be there, but you don't find, you don't see the scientists actually tell the what is the evidence. My second point is that I think scientists have a key role to play in evaluating policies. And governments should actually, whenever they put in place a somehow controversial policy, also have more of a culture of evaluation. And through evaluation, potentially say 3 years later, well, we got it wrong, we should change. Interesting that Theresa May actually collected that evidence but didn't do much with it. And yesterday in another session I gave the example, which to me is fascinating, of the Czech Republic. In 1989, so let me just repeat it, in 1989, President Václav Havel, who, as you would remember, was a heavy smoker, came to the Czechoslovakian, at that time, parliament and said, "Dear colleagues, I would like you to decriminalize drug use and possession of drugs for personal use, whatever the drug, because I don't see why I can smoke, why I can drink, and why I wouldn't be able to safely consume a drug if I bring no harm to others." And the Czech parliament decriminalized drugs, 1989, all drugs. By the way, in the Czech Republic now, this is the lowest use of drug use in Europe, and the lowest rate of HIV infections among people who use drugs. 10 years later, after a change in government, the government wanted to recriminalize drug use. And that generated a huge debate in the country, and in order to sort of smoothen things, it was decided that there would be an independent scientific evaluation of that new policy of recriminalizing. And 3 years later, based on the evidence, the parliament re-decriminalized. And to me, that's a remarkable example of the interaction between science and policy making. So my call here would be for scientists to engage in multidisciplinary evaluation of policies, and for governments to call on independent evaluations of whatever difficult decision they can take in a policy making.
Thank you very much, and I think now I'm opening the floor to you. We have 2 microphones, So please, yes, please. We will take 3 questions at a time, and then we will continue. Please.
Thank you very much for your well-founded arguments. And yeah, I think it was a very strong argument for reforming drug policy. And I was wondering what would be the best model to reform drug policy, why it's Europe that should lead this drug policy reform and not, for example, like the US, because there, I read in this Nature issue, which they're giving away for free here at the ESOF, I read that in the US, drug overdose is the #1 death cause in the US for under 50-year-olds right now. So that should be, I think it's a very hot topic. Even Trump has stated that he wants to somehow overcome this drug abuse issue in the US. And then I was wondering if drug possession would be legalized in Europe, then will there be any new problems arising which we haven't thought of yet?
Thank you very much. I think we have someone on this side and then one more at this side, please.
Thanks for the talk. Given the persistence of that gap between what the politicians are publicly putting forward and what they sort of know to be true, or their evaluation of the evidence out there, are you guys optimistic that the government will start changing their tune, or is this going to actually have to come from like a broad-scale social change?
I'm certainly convinced that by your argument, and I've been convinced for quite a while, there is a kind of killer argument in this discussion, is the story for children. That supposedly, if we legalize drugs, this will be opening an avenue for children, and we probably agree, at least as teachers, that we don't want to have our students to come to classes having smoked joints of cannabis. So how do you deal with this killer argument?
Thank you very much. So I will pass Cernig.
Well, the first thing to say is that much though I've tried to paint a picture of the contradictions between public opinion, what governments and politicians do, and the evidence, the drift of events, back to your question, is in the right direction. It's uneven, it's erratic, it's often sort of 1 step forward and 2 steps back. It's, as Michel just wonderfully described, sometimes accompanied by governments trying to reverse progressive reforms and then failing to do so. But broadly speaking, the drift of reform is in the right direction. If you look at the number of European countries where medicinal cannabis is now permitted, I mean, it's transformed compared to even a few years ago. So that's the first thing. The second thing is I think there's a big generational difference here. There's a lot of cephalological evidence that suggests that young people are just much, much smarter about how irrational the war of drugs is, how irrational it is to apply a criminal justice a solution to what is in many respects a health problem. To the question about our children, I think one of the most important arguments which scientists, lawmakers, and politicians need to make, and very interestingly, Justin Trudeau's government in Canada has chosen, in my view, very wisely to promote the reform of the sale of what will become the regulated sale of cannabis in Canada, almost entirely through the prism of criminal justice. So he's allowed senior police and law enforcement officers to take the lead in explaining why it makes more sense to protect our children by going after the criminal gangs, going after the people who break the law, rather than wasting a lot of time prosecuting people who are taking it for personal use, and that in turn will be a better way of protecting our children from the menace of those criminal gangs who otherwise are keen to, of course, push their products to them. So, I think the drift of events is going in the right direction. I think kind of the generational change is a good one. I think there's a very powerful argument to say that if you've got these substances, drugs, which, as I say, the vast majority of people who take them because they want to, and it sort of doesn't do anyone else any harm. But they can be very harmful. Surely the most stupid thing to do is to put the sale, the industrial scale sale and retailing of those products in the hands of criminals who don't give a damn about people's health or the welfare of our kids. So I think we need to deploy, certainly in the political realm, just a much tougher kind of, why are we being so soft on the criminals? Why are we allowing them to get away scot-free? Why are these people who claim to be in favor of the war on drugs, why are they so soft on criminals? They're the wimps. Us drug reformers, we're the people who are tougher on criminals, as, by the way, we would be. Because all the evidence is that it does diminish the capacity for the criminal community to do well. And not that the parallels are exact, but if you go back to prohibition on alcohol in the 20s and 30s, you saw something which is, as I say, not exactly the same, but very similar, which is what did the criminal gangs who ignored the law do? They had an interest in marketing and selling the hardest stuff. You didn't have sort of low alcohol beer in an age of prohibition because there was absolutely no interest for anyone to sell it. And, you know, in my country, there's a huge controversy around skunk. Skunk is a very, very potent and can be highly damaging a drug. It's quite different to the sort of traditional weed or cannabis that was taken sort of 20, 30 years ago. And yet in many ways it is a product of the fact that the sale of cannabis is prohibited. If you regulate the sale of cannabis, you could legislate to balance the THC and CBD, the two components in cannabis which need to be kept in balance to reduce the harm. You could impose age restrictions, and you could literally just eliminate out of the market some of these really, really kind of very, very potent and potentially damaging substances like skunk. Sorry, so I think I don't think regulated sale is, back to your question, is the answer to everything, because you won't be able to eliminate drugs, but you will significantly be able to reduce the harm.
I'd like to touch on your question on the opioid crisis. The opioid crisis in the US did not actually started with illicit drugs. It started with licit substances, that is, with the medicines. It started with overprescription by physicians who were actually paid by pharma laboratories in a most scandalous way to be encouraged to prescribe painkillers or opiates for pain killing when it wasn't absolutely needed as a prescription. These medicines were over-advertised on television. And, you know, in the US, there is this sort of attitude, whenever you have a problem, you need a pill to solve your problem, whatever the problem is. So people would be driven to take the most efficient painkiller, yeah? And then they would get dependent on that product. And they would come back to the physician and they would say to their family members or friends, look, that is really a good substance. I feel good with it. And then prescriptions would be diverted. That is, people would take these medicines from prescriptions to others. And then when the supply would become difficult, the black market that knows how to adapt itself so well would come and say, look, we can provide you with heroin, which is the same substance, yes? We, physicians, call it diacetylmorphine. On the streets, it's called morphine, heroin, but it's the same substance. We can provide it to you with at cheaper prices. Just come to us. And that's how it moved then to heroin. And that's how in rural parts of Indiana, 3 years ago, there was an abrupt outbreak of HIV. No one understood. Because in that rural area, people started injecting heroin and sharing needles. And interestingly, this was in a context where harm reduction services, that is needle exchange, methadone, were not available because the governor was very opposed to it. The governor at that time then had to change its, the policy against his own convictions. That government was Mike Pence, very interestingly. So that's the story. And then things got worse and worse, because not only the heroin came in addition to the prescription medicines, but then fentanyl came in to cut the heroin, and that really triggered a huge wave of overdoses. And now, as you know, overdoses are killing more US citizens every day than car accidents or than HIV/AIDS at the peak of the epidemic in the 80s. It's a huge crisis. But to us at the Global Commission, it's just the example of what regulation should not be. If you regulate medicines, regulate them properly and have things advertised on television, and doctors receiving bribes for prescribing is not regulating.
Thank you very much. I think we have quite a few questions. I have to say that our time is running out. We started this side and then move to one, and we will take 4 this time, but they are the last ones because I need to give time for them to respond. Please.
Thank you. Dominique Leglu, I'm the editorial director of La Recherche and Sciences et Avenir, and we published already an interview of Professor Kazatchkine on our website. I would like to know whether you can make a recommendation as members of this Global Commission to France. L'Observatoire des Drogues, Drug Observatory, says that the social cost of tobacco per year in France is 120 billion. That alcohol costs 120 billion, and that cannabis costs 9 billion. So what would be your recommendations for our government? Thank you.
Yes, Anton Thompson. I would like to come back to first your description, sir, about the difficulty of doing research in this domain, and Michel comment on regulation, because the two are, the evaluation, sorry, the two are linked. I'm in a public health domain of research, and I would like to give the example of the law we have in France for bioethics, where it is written in the law that the law every 5 years or regularly will be reassessed. And that triggers debate in society, but also research, because you need evidence for the politician to take into account the debate, the evidence, and so on. So I was wondering how this kind of element, which is efficient, because you declare that the law can evolve, could be adapted to the domain we are discussing today, because it opens possibilities also of funding for research, whether it is very difficult to get public funding for research, which is trying to show that the law is wrong. And this is a difficulty. So I would like to know how you could comment on that. Thank you.
Thank you very much. We go back to this.
I was really taken by your comments about the power of fear as a major block in this area. And I just wondered, what do you know in terms of evidence to help you do something about this major block?
Thank you very much. We go to this side, and I see that I have...
Of course. No politician resigned in protest when scientific advisor David Nutt was fired in the UK in 2009. How can scientists have confidence that they'll be protected after whistleblowing on irrational policy, not just for drug reform?
Thank you very much. One last one.
Coincidentally, following up from this point, I work at Sense About Science, so we awarded David Nutt the Maddox Prize for standing up for science a few years ago. I just wanted to underline to the panel that right now you're asking scientists to come out of the labs and engage while they're in the throes of their career, to face the fear of the Daily Mail while they're still building their own careers and their research, where politicians talk about this behind closed doors and after they leave office, like William Hague did recently. You're asking scientists to be braver than policymakers right now. Policymakers have got to catch up.
Thank you very much. Maybe someone should be courageous and brave, and science always have been known by that. But I will let Michel to start, and then...
Thank you. Just very briefly, Dominique, I think France is among the most conservative, if not the most conservative, country when it comes to drug policy. There is currently a law being discussed that is basically a reassertion, reaffirmation of the fact that any drug should be should face the criminal justice system. So there's nothing looking like decriminalization in France at this time. And I shan't go back to all the reasons why we believe decriminalization is a key step that would considerably reduce the harm of drugs and drug policies. And on the law, it isn't just the ethical framework that is so agile in France that would be the obstacle, but the fact that these substances are illegal, illicit, because of the international drug control system. So you cannot go for a clinical trial of cannabis or LSD or ecstasy that do have medicinal potential, because you just cannot use these substances because they're illicit. We're in a vicious circle here. And even if, so I doubt that a change in our ethical framework would see the French politicians brave enough to go against the international conventions, which brings me to the last comment. There are brave politicians across the world. Of course, I mentioned Václav Havel earlier because I think this is a remarkable example. The Portuguese government, which Nick mentioned 20 years ago when actually Antonio Guterres was prime minister, but more recently, when states in the US started by referendum voting for the legalization of cannabis, while the US government and state was actually fighting with Uruguay and saying Uruguay is crazy, it's going out of the conventions, President Obama didn't move. He knew that legalization of marijuana was against the international conventions, but at the federal level, he didn't move, which by itself was a very brave move and a strong signal to the international community.
Thank you very much.
Just on I'm a big fan of what we call in the Westminster system sunset clauses, where a law automatically falls unless there's an explicit decision to restore it. We don't use it nearly enough, but I think it's a really important innovation that should be used by lawmakers much more regularly for exactly the reasons that you have described. Is that it then pushes people to look at the evidence, to revise their point of view. And politically, it's often quite a good way anyway of getting something controversial onto the statute book. You say, look, if you don't like it, you can always get rid of it in 4 years' time or 5 years' time. So there are good high reasons and low reasons for putting a sort of sell-by date on legislation. And I strongly agree with you. That's something which I'm interested to hear that operates in France. Though I have to say, I agree with Michel. There's not much. I was reading the other day that in Paris, I think there is a cafe which is selling cannabis with no THC in it at all, right? So the two substances are, the CBD is the one which makes you feel a bit droopy and sleepy, and the THC is the stuff which makes you feel a bit more peppy. So it's a really kind of very sleepy product that they're, quite literally, that they're selling, and even that's being closed down by the government. So, I mean, So I'm a great believer in sunset clauses, but there isn't that much evidence that in this area of public policy, it's leading to much innovative thinking amongst government circles in France. To the lady who was asking about, why should science... Yeah, there you are. Yeah, of course you're right, absolutely. Why should a scientist come out of the lab in their white coat and take on the ghastly people in the Daily Mail when politicians are not prepared to do it? I totally agree with you. And I'm certainly not expecting or asking scientists to do that. I would expect and ask of scientists to publish and talk about the evidence as they see it, and where that research touches on drugs, I would hope they should do so. But I quite agree with you. I don't think scientists should be asked to act as a sort of a surrogate political advocates where there is a lack of political courage itself. No, absolutely not. And I'm a great admirer of David Nutt, and whoever gave him the prize, you were quite right to do so, because he's a brave guy, and someone who was hung, drawn, and quartered by the Daily Mail myself for about half a decade. I know what the poor chap had to endure, if for a slightly shorter time. Just the final thing, really, is this point about fear, to which I, of course, don't have a simple answer at all, and I don't want to bring the dreaded B word into it. But I've seen in my own country a couple of years ago what I consider to be a hugely self-harming and damaging decision to leave the European Union, in which millions of good, decent people have voted, in my view, in a way which will harm their own interests for a bunch of different reasons. I don't know why 17.4 million people should decide to vote that way, but I do know that a lot of them were fearful, and that fear played a huge role in propelling people towards the false certainties of pulling back and retreating. And in the same way that lots of decent, good people voted for Donald Trump in believing that if you build a wall, you'll feel safer and better. There's a lot to be fearful about in the world at the moment. So my only observation is that when people are fearful, giving them statistics, giving them research, giving them empirical analysis is literally like speaking a different language. I mean, you might as well speak a language which they have never heard of before. It literally doesn't, it's not heard. You're talking right past each other. So I think one of the things that people who believe in evidence-based policy need to do, and it's a tricky balance to strike, is to be respectful of evidence, but to do so with more emotion. There is a perfectly good emotional case for reform of our drugs laws, because at the moment we are harming our children. We are turning a blind eye to deaths, needless deaths, and we are turning ourselves into the best friends of some of the nastiest criminals on the planet. And I think, I'm not in politics anymore, but if I was and I was trying to make the case, those are the kind of arguments I would make. I wouldn't rely on statistics showing that X, Y, Z graph shows, A, B, C, empirical predictions, because it's just the wrong language. So it's a tricky one. And by the way, this is a wider debate in mainstream politics generally, at a time of rising populism and the rising politics of anger and fear and the disparaging of evidence and the disparaging of science and so on. How do you hold on to the Enlightenment values of evidence, debate, science, proof, but convey it with greater emotional impact? And the next generation of politicians who can marry those two things will be important figures in helping us out of some of the predicaments we presently find ourselves in.
Thank you very much. I think we have reached the end of our session. I would ask you to stay, because we have a treat, I would say. We have two short presentations of young scientists that I think would really be nice if we can stay for these two new presentations that we'll get. And I think there they are. Why do people choose to use homeopathic remedies despite the lack of robust evidence? By Nanon Canepen. Do we have the first? Yes, please, the floor is yours. We will keep sitting here, So, but we give the floor to you.
Thank you. Right, good morning, everyone. Thank you all for coming this morning. So for my PhD, I was very interested in what type of evidence people value when making health decisions, because that's something we do almost every day. But obviously, it's a very broad topic, so what I wanted to do is focus on something, and I chose to focus on homeopathy. So homeopathy is a type of complementary medicine that has been shown to only work as a placebo effect. So any perceived effectiveness is due to the placebo. And despite the lack of scientific evidence, there's more and more people using homeopathy all around the globe. And so I wanted to understand why. Why are they using it? So how do they argue for its effectiveness? And so what I've done is I used a mixed methodology. So I did a nationwide survey followed by semi-structured interviews. And I did all that in New Zealand, because that's where I'm working, at the University of Otago. And so today I'm going to talk briefly about my results from my interviews. And so in the interviews, what became very evident is that people who are using the remedies do not value scientific evidence. So next to the brain here, you can see one headline that came out in 2016, just after a big review that was published in Australia in 2015. And so it uses the facts, so the scientific facts. Homeopathy does not work more than the placebo. That's it. And what happens is that for people who are using homeopathy, they use it because they perceive it as working for them. And so because of that, when they read that headline, it's really dismissive of their personal experience. So they're not going to read that article. They go away from it. And what they use to argue for the effectiveness of the remedies is, it works for me. I used it and it works for me, so science doesn't know. And the other type of evidence that they argue for is, my mom has been using it, or my friends have been using it, and it worked for them as well. So anecdotal evidence. And the last type of evidence that's very important for them is traditional evidence. So they say that the remedies have been used for so long, therefore they must be working. So they use those three types of evidence to argue for the effectiveness and reject science as not being able to show the effectiveness yet, or science is not important for them. And so if we take a step back, what I want to think about is how we can use that data to improve our health communication. Because at this stage, when we write articles about homeopathy, the audience we're trying to target is those people, so we want to tell them about the risks related to those remedies, but not going to read the articles, because they don't relate to them. So we need to acknowledge the value and use their values to create a new way of communication and start a dialogue to make sure that they're going to listen to what we have to say, instead of having that barrier between the scientific community and people who believe in those remedies. All right. So if you have questions, just come and see me. I have a poster number 73. Thank you very much for listening.
Thank you very much. Really a pleasure. And we have a second speaker, the next step towards remote eco-friendly point-of-care diagnosis by Laura González Macia. Laura.
Good morning, everybody. So my name is Laura González Macia, and I'm a Marie Curie Research Fellow at Dosas and Sensores, which is a biotech company which is placed in Bilbao in the north of Spain. And today I'm here to introduce our work on paper biosensors towards eco-friendly point-of-care diagnostics. So first of all, I would like to thank the organizer for the opportunity of presenting here, and also the Marie Curie Actions and the European Commission for the funding. So in the last decade, there has been a big revolution in the area of the healthcare monitoring and diagnostics, mainly due to the development of home-based and self-testing analysis. So these point-of-care devices, they are like miniaturized portable devices that integrate all the functions from centralized laboratories without the need of the trained staff, and they are also disposable, they are easy to use, and they provide a very rapid response. So many of these point-of-care devices, they are based on electrochemical biosensors, which are like integrated devices that they are capable of converting the recognition energy from a bioreceptor, like an enzyme or a microorganism or a cell, at the analyte of a sample into a useful quantitative or semi-quantitative analytical response. So at Osasen Sensores, we offer like innovative point-of-care diagnostic devices and based on these electrochemical biosensors. And I think one of our advantages is like we cover, we have the resources and the expertise to cover most of the stages of the value chain. So from the platform fabrication to the deposition of this bioreceptor, the fabrication as well of the readers, and then the assembling and the packaging. So until now, we've been working on plastic substrate, but recently, due to the big necessity of preventing the waste generation and the use of plastics, together with the necessity as well of provide affordable devices for the general public, so the paper has arisen as a very good or very promising alternative for this kind of systems. So white paper, okay, it's more environmentally friendly, it's easy to dispose, it requires low sample volume. So now we are working on 2 projects for having applications, diagnostic devices for hypolactasia and sepsis to use with samples such as whole blood, urine, plasma, and serum. So if you are interested in the area and you would like to know more, I just invite you to come over the poster session and talk to me. And I'm poster 71. Thank you very much.
Very much, Laura. I think it's the time to thank you, the 2 speakers that I think create a space for a debate of a very important topic, and I hope that ISOF and other open science forums like ISOF will bring this discussion also back to science and back to this connection, as you said very well, science, policy, and society. Thank you very much. Please, a final round of applause to our speakers.
I've got to run, I'm afraid.
Yes, we will talk. Huh? It was so beautiful.